Hi, I'm Dr. Kary. I'm a board-certified sports medicine physician, and I've been with Community Physician Network since 2022. I work with athletes and active individuals, anyone who has a goal and wants to get better from their injury and get back to doing what they love. So that could be anyone from a runner who's training for a 5K or a half marathon to a football player who wants to get back out on the field. Through all of that, though, I do find I gravitate towards endurance athletes, helping to take care of endurance athletes. I was a competitive runner all the way through junior high and through college, and still enjoy doing that. I've raced in the Boston Marathon, the New York City Marathon, the Chicago Marathon, and I really enjoy those kind of endurance endeavors. And through that, I've really learned how challenging it can be to face an injury or some kind of condition that's preventing you from reaching your goal. And so I take that into when I'm helping patients and can say, hey, I understand what it's like to be in this situation. Let's work together to help figure out what's wrong and see how we can get you to that next finish line together. I want them to know that I'm there to come alongside them in their journey, to listen to their concerns and to help guide them and shepherd them through the medical process. It can be intimidating as a patient. And so I want to listen to their concerns, perform whatever examination is needed, order whatever tests are necessary to help identify what's causing their issue, whether it's a bum knee, a strained hamstring, like I said, or some other kind of injury or issue. The other thing I will mention too is that I have extensive experience in sports ultrasound. Over the last decade, I've trained over 250 sports medicine doctors in the use of ultrasound for diagnosis and treatment when it comes to sports injuries. And so I utilize ultrasound all the time in my office for looking at soft tissue injuries like tendinitis or tendon tears or bursitis or muscle tears. It's a great imaging modality because I can figure out what the problem is right there in the office and oftentimes treat it using ultrasound. Scientific literature has shown that ultrasound-guided injections are more accurate and more effective. And so I use that to care for my patients, and I'm always trying to stay on top of the latest minimally invasive ultrasound-guided procedures that will help my patients. Well, I try to start every day by pausing and thinking about the people who are going to be coming into my office. Oftentimes they're coming in scared and nervous, not sure what I'm going to say. They don't know whether I'm going to tell them, hey, this injury is going to end your season, or this issue is going to keep you from getting back to work. And so I try to just make sure that I'm a trusted voice along their journey, guiding them and giving them the information they need, and just really trying to remember that I'm taking care of each patient just as a person, one person at a time, trying to meet their individual needs. I'm Dr. Kary. I'm a board-certified sports medicine physician, and I've been with Community Physician Network since 2022.